can see you on here, so I'm going to turn it over to you, my lady.
All right. Do I have the ability to share my screen? I think I do, right?
Good.
Okay, excellent. Hi, I'm Kindra Crick. I have an 8th grader here at Tabor, who is a web leader, and I'm joined by Sabina Haque. She is going to be, we did this presentation at Richmond. I should also mention I have a 5th grader and a 2nd grader there. And so when we did that, Sabina was looking at the chat to answer any questions, and she provides information in there. But I am going to share my screen. Let's see. And just go over this presentation. And then, which is going to kind of cover a lot of information that we've gotten from PPS. We sort of aggregated this. And then information about both symptomatic and asymptomatic screenings, and then open it up at the end for questions. And I should give a little bit of background. My background is I'm trained as a molecular biologist, and I've worked in labs, I've done PCRs. I got very interested in testing last July and have mostly worked at the federal level to increase access to testing, which just means that I know a lot about testing, how it's done in other countries, how it's done in other states. And so just providing you with what Oregon is offering, and just kind of a resource in terms of my understanding of testing to answer questions, because mostly just people have questions about what are they, how are they different, etc. So without further ado, I'm going to get started. Hopefully you have all seen the Swiss cheese model for a respiratory virus. A virologist out of Australia created this visual, and it is brilliant because we do mitigations, and each layer has holes. The more you put together, the stronger they are in terms of being a way to keep a community safe. So I'm going to focus on 2 of them. And if you can't see the visual, there's the Swiss cheese with the stay home if you're sick. And if we all knew we were sick and we were staying home, that would be super easy. But because COVID is extremely sneaky and extremely transmissible, especially Delta, and it can be asymptomatic, testing is a great additional mitigation measure. And so we'll be talking mostly about that today. All right. So I'm going to go back to the basics. That first one, which is stay home if you're sick. I can't emphasize how important that is to keep a community safe. So not only Tabor, but also Portland and Oregon. So Delta kind of changed everything in terms of being extremely transmissible. So the more we can stay at home when we're infectious, the better our community is. And that means just being mindful every morning of, does my kid have a fever, a cough, or any of these symptoms, something that's not expected. And then just kind of seeing that as a way that you can protect the community by keeping them home. And again, you're going to do all the sort of basic things you'll hear me repeat a few times, which is you want to call the school, the nurse is available, they're going to talk to you and let you know about your individual situation. And I will tell you, I've already gone through this, right? My daughter, she had a fever. So I happened to have access to rapid tests. She was negative. I kept her home from school. The nurse called me. I went to my pediatrician. I got a PCR. She was still negative. But again, she had a fever and wasn't feeling good. So I kept her home. So you're going to want to kind of see that in this year in particular, because there's a few different bugs going around. That's one of the ways that we can kind of keep those ambiguous symptoms out of school, but most importantly, keep COVID from spreading in school. And so that's kind of the obvious one, but you do need to state it because it is something you're doing every morning to kind of monitor your own child. All right. All right, but if it so happens that your child makes it to school, we're going to talk about the first type of testing that hopefully you've already signed up for. And this has been offered since April, and that is symptomatic testing. So if a child shows up and they have a fever or a cough, in any year, they would go to the nurse's station, and if they have excludable symptoms, they're going to be sent home. You're going to be called, you're going to pick them up. One thing which is offered at school, which is a benefit if your child is opted in, is symptomatic testing. And so that is these rapid tests. They're Binax now. So if your child is opted in and they can perform a nasal swab, which is just like picking your nose, it's a lower nasal swab, they can do that 15-minute test. And the wonderful thing about these tests is they are fast. And they will tell you if you have 100,000 particles of virus or 1 million particles up your nose and you're contagious. So you could, if you've opted in, if that shows up positive, you can use that information to make a choice, which is maybe you don't want to have grandma come and take care of your child. So that's information that can be given to you if you have signed up. So I encourage you, if you haven't done so, that you sign up for the symptomatic testing, which is the type that's done at school on site. And so I just wanted to kind of give you a visual of what that looks like. And that requires your consent. One caveat, is that, and I might say this multiple times, is that testing doesn't predict the future. Okay. So with rapid tests, if you have a high viral load, because it's looking for the protein in the virus, if you have enough particles to kind of set that off, it's usually considered a contagiousness test. And so you'll know that information. If it doesn't show up with these kind of the 2 lines, so it's considered negative, or what I'd like to say, no virus detected. If your child continues to show symptoms, you are going to want to test them again. And one of the reasons, for example, that if you are able to get one of these in the store, why it comes with a pack of 2, if you read the instructions, it's because you're supposed to take the test 36 hours later. And that allows it to have this high sensitivity because it is rapid, it gives you information, but it's really at that peak viral load that it is going to show up positive. And you can either get a test like a rapid test or get a PCR, which is done in a lab. And at the end of this, we'll give you some resources, but just kind of keep that in mind. If your child continues to show symptoms and they were negative, you will want to test them again. All right. And I'm just providing this visual just because this is kind of the trajectory of what an infection looks like. The first few days, there's no test during that incubation period that is going to show up positive. We're later going to discuss PCR, which is at the very beginning of an infection. You'll just have this very rapid rise in viral load. And so something like a molecular test or what we call a PCR test looks for RNA, and that can be detected at extremely low levels. So that is highly sensitive. And so it's considered a diagnostic test. So it will tell you, it answers the question, do I have any stage of COVID? Whereas I would say the rapid tests are answering the question, am I contagious right now? And so the distinction between those 2 tests kind of, I just like to point out because they have benefits in terms of a PCR takes longer, but is more sensitive and is diagnostic, and a rapid test is immediate, but will tell you if you are contagious. All right. I'm going to go through 2 response protocols, and hopefully I'm still correct because I'm a little bit in my Richmond mode of answering this. But let's say outside of school, your child tests positive for COVID. Let's say they went to a wedding. Again, it's your responsibility to call the school and to keep your child home. The more tricky one is if your student has been in close contact with someone you know has tested positive. So for example, a carpool mate has tested positive. Again, it's your responsibility to understand that a close contact is someone within 6 feet for at least 15 minutes. And this one is the one where I've heard it done wrong. So the example I heard, parents tested positive for COVID and they continued to send their child to school. And then 3 days later, their test came back and that child had been at school for 3 days infectious. So please be mindful of, if you do hear of a close contact, that is a time that you want to keep your child home from school. And I know that's really difficult, but it really is one of these powerful tools to keep the community safe. All right. And then this one we've already seen. Tanya, if there is a case at school, she will send out an email letting people know that there's a case at school. And then if you receive a second email, that will give you information that it is your child and that they will need to quarantine. And this is specifically because of privacy. You'll notice when I talk about OHSU that there are sort of great attention to privacy when dealing with children who are infected. So I think that's really important to note. All right, so here, this is new and it hopefully will come before the end of October. This information we've gathered from PPS and also from OHSU, so I hope that I am conveying this information the best I can. The important thing about this, and especially you can see this in other countries where they do testing and in other states where they do testing, this is a really strong mitigation measure and it's stronger with more participation. So I know that we're the ones who are on this meeting, we're learning about this, but if you can encourage other people at Mount Tabor, that only strengthens this particular mitigation measure. And it also is the only one that gives you actionable information. And I'll talk about that a little bit later. But it has been shown that you can actually reduce outbreaks by 50% if you have asymptomatic screening. Because unfortunately, children are the ones who are most likely not to show symptoms. And the tricky thing about this virus is that it is very effective at spread. And one of the ways it is effective at doing so is that you can transmit the virus unknowingly. And so that will pick up asymptomatic cases at school. All right, so the details about what OHSU has offered, it's actually pretty exciting. So it is a PCR test. So it's that very sensitive molecular test that will catch the earliest stages. It is also a spit test. I don't know if you know this trivia, but I'm so into testing. The NBA actually sponsored the research for the spit test, and it was what kept them playing all last year. So that is what OHSU is offering here. And so it's painless. If your child can spit, they can do the test. And then in terms of privacy, that we'll actually go into the details of how the test happens in the next slide, but I just wanted to get these things through. So children will be sent home with these spit kits and information of how to do them. They will then be couriered to OHSU, and then that lab will be done hopefully within 24 hours, but definitely less than 48 hours we'll get information back. And an email will go to you if you have opted in. And so about your child's test results. And so that will be negative, positive, or inconclusive. If it's positive or inconclusive, then a nurse from OHSU will call you. So here's the tricky thing is that they're going to call you with that information, but it's your responsibility to actually contact the school with that information that your child, let's say, is tested positive. And of course, to keep them home. In terms of the details for Mount Tabor, as I understand it, test kits will be going home with children on Wednesdays, and then you'll have to wait until Thursday morning, first thing, for your child to spit in this special tube, and then you will bring it in and provide it into a cold bucket, and then it will be couriered off to the lab at OHSU. So the most important part about this is opt-in. So if you want to do this, you need to hand in the 2 forms to opt your child in. And as I understand it, you can opt out at any time. And the information is linked below, and I think Sabina can provide the links to the forms, which then you can provide to the teacher to hand in.
Yeah,
so that
all
you
the
can
forms
participate.
are in the chat as we have been speaking. And just remember, there are 2 forms. You have to do the
Right.
OHSU form, which provides them with a medical ID number. So it
Mhm.
will have the logo for OHSU on it. And then, of course, you have to do the other form that we talked about from Oregon Health Authority. But yeah,
Right.
those are in the chat. And of course, Tanya has been sending them out weekly.
All right. So this information, which is the collection, will be sent home with children, and it will just walk you through the simple steps of being able to have your child, spit up to the right line level, how exactly you place them in the biohazard bag so that the information is seen. And then there's going to be a ice bucket at Tabor that on Thursday mornings they'll bring them in. And I guess the most important thing they wanted to convey is first thing, or at least 30 minutes after eating or brushing teeth, because that those particles, I guess, can cause the test to not, come up with inconclusive results. So that they wanted to convey that to parents. So but this information will go home with each child who is going to do the test. So I didn't want to. So they're quick, they're painless. We do have a link here to a video so you can actually watch an example. They do outreach, so we link to the video in case there are curious minds later who want to know how to do the collection. But what I really want to emphasize is that testing is a very strong mitigation measure. And it is the only mitigation measure that provides information. And that is going to become very, very important kind of as we progress through the winter and want to progress out of mitigation measures. And it can stop an outbreak before it begins, because the best way to stop transmission, because each person sort of kind of creates these branches of who they can spread it to. If you can stop it at the very beginning and be an end of a chain, that really lowers what they call the R value, and that can actually completely stop a pandemic. So South Korea stopped their pandemic in their tracks based on testing alone. So I can't emphasize how wonderful this is as an opportunity to be able to provide this, and that the more people we have who sign up, hopefully the fewer cases and that we can have in our schools. And then also, I think about this a lot, is that you can actually really see the power of the other mitigation measures based on the fact that this is information that is coming weekly for the school. So it gives confidence that all the other layers that we have in place are working. So I think the last slide here is just something Sabina put together. Thank you, by the way. Testing is available, and just because of my activism, I know that it is going to be ramping up quite dramatically through December, just in terms of accessibility. So although you can't get rapid tests right now, there's been a lot of money put into that so that those are available. But this is a list of all the places that you can get free testing, and Brave Care is specifically for children, which is nice, especially if you have younger children. And I do know that Walgreens and CVS offer free testing. And the only challenge I know about it is it's not necessarily always immediate. You have to sign up for a time. So write down things that are close to you here, and this is just going to be available for
and I
our
have to
parents.
say, I just want to pop in here. My son Sumer, who's an incoming 6th grader, who's 11, he got a cold about 10 days ago, or we weren't sure, but we kept him at home, and then I called up Brave Care. They're open 24 hours a day. So when he told me at night that he had a sore throat, I was like, shit. Okay, so I called Brave Care and I was like, when's the next appointment? Now, what's amazing about Brave Care is that you can go in there. I actually have Kaiser insurance, but you can get a free COVID test, whether you're insured or uninsured, if you have a child. Okay, so it's 100% care for children, and specifically free flu shot, vaccines, and COVID testing. Now, what's also interesting about their particular test is the one that you go to Hawaii and you pay $150, and it's a NAT test, a nuclear test. So it's almost like a PCR. It's the same idea. So it has 95% accuracy, even if it's early on in the stage of infection. And they will do the test at that time, and you can get the results in 15, 20 minutes while you wait for the pediatrician to come in and show you the results. So I think they're an excellent resource. I've sent many people there. I found them by accident because my sister was traveling from overseas and she's not insured in this country. And I was like, where can I get a free test, that is not going to break the back? So they have a number here. This is their hotline. You can call them anytime, day or night, and they will schedule you. And usually you get an appointment within 10 to 12 hours. I got an appointment. I called that night and I got an appointment at 4 o'clock the next day, took him in, got him tested. And I also called the school, sent, Tanya the results, told her when the onset of symptoms were. And then he was able to come back within, I think it's 24 hours from the onset of symptoms. And also if you have a negative test. So again, I think we just have to be really careful about testing and using that. The other thing that you can do is if you have the resources, you can order one of those rapid tests online for $24. You get 2 tests. But it's expensive, right? And so that's the challenge. These are all free testing. So either of these, you can look at them later.
Right. And the government has an initiative. I know that there's been $3 billion spent on testing accessibility. And that should be sort of coming online, especially in November and December. So we'll see more accessibility hopefully very soon. All right, so that's it. Hopefully I covered everything, but and maybe Sabina's been answering questions in the chat, but if anybody has anything that we didn't go over, please ask your questions now. So I don't know how to open it up to.
It's open. If anyone has a question, you can just unmute yourself. And thank you both so much just in advance of the questions for the presentation. It was really informative. I learned some things. I know more about COVID than I, already, and now I know even more than I ever wanted to know.
That's right.
So my understanding from the possible exposure at school, so the first email goes out, and I haven't gotten a second email, but my understanding is if you get the second email that says your child was whatever the parameters are, that if they are vaccinated and you can prove that it's your choice whether to keep them home or not. At least that was from the high school that I was understanding that.
I can talk a little bit about that if you'd like. So if you are an exposed close contact at school and you get that second email, you get a phone call as well from School Messenger and the specific details. If you can send us proof of vaccination that your kiddo has completed both doses of their vaccine sequence, and have gone past those 2 weeks after the last one, as long as they are asymptomatic, they can continue at school. However, if any signs of illness show back up, whether it's a runny
Right.
nose or something that's not a primary symptom, they immediately go back into quarantine, and then you need to go get tested before they come back.
Okay. Just curious. Yeah, thank you.
Yeah.
That's a really great question, because I was actually thinking about that because I had done this presentation to Richmond, and nobody's vaccinated there. So
Right, yeah,
a
different. I have an
different
elementary
scenario.
school student too, which is very different thoughts than my middle and high school students. They're vaccinated and I have different. At the same time, my brother's family of 4, all vaccinated, all got COVID last week. So,
Right, right.
you know, yeah.
Well, and I have a question regarding that because my daughter graduated from Mount Tabor and she's a 9th grader at Grant, which currently has an outbreak. An outbreak is more than 3 people, and I think they have 20 COVID kids, the entire high school football team. And some of them are vaccinated and some of them are not. And so these are considered breakthrough cases. And Kindra, I don't know what your take is on, I mean, Grant High School is one of the most highly vaccinated, neighborhoods. We've been looking at this. So, and we get a case every other day there. And I'm just wondering, how does asymptomatic, because we've signed her up for asymptomatic, is that going to help with managing breakthrough cases in high schools and middle schools which are packed right now to the seams with kids?
Actually, oh no, I'm on mute. All I can say is that every time you prevent anybody who's transmissible into a space where people are sharing the air, that reduces spread. I mean, that's what the Rockefeller research showed. I think the one thing which concerns me about Delta is that it has this really quick peak, so that if you do catch it, you're vaccinated. It causes a huge spike in viral load very quickly. The nice thing about it is that it tapers off very quickly. So your immune system is already primed and it drops it very quickly. And then Victoria had a question. Oh, someone else answered it.
Well, just you want to explain what that is, Kindra, about the situation with the vaccine for the 11th. What does it mean that they're having a meeting on October 26th?
So the FDA, which I use for being trusting of vaccines, Pfizer has run their trials. They extended them so that they could, see if there was any kind of signal of anything that should be noted with young children. And on the 26th, that information has been submitted to the FDA, and then the FDA meets and the experts review that data for their phase 3 trial and gives the opinion about whether or not there should be an EUA issued. That's the first date. I also know that there is a second meeting, which is done by the CDC, which will be probably, I think it's November 2nd. And then they will sort of officially give the guidelines. And as I understand it, the states have been prepped because in this age group, the hope is that this lower dose will be given out to pediatricians because that's where families typically are more comfortable with receiving vaccinations. So my guess is that if it's approved, they will be available sometime either the first or second week of November. So there's like, and I think even Oregon, Washington, and California has sort of looks over the data as well. So again, they are coming pretty soon, but it's still not until after the first week of November, as I understand it.
And based off of what Susie was mentioning, our kids who are 11 and under won't be fully vaccinated until they've finished the whole 5 weeks. I mean, they'll have to do the first dose, second dose, and another 2 weeks, right, Tanya, before they could get a free pass to yeah. So anyway,
everybody was crossing their fingers for Thanksgiving. That was what I remember. So, but it'll be pretty close.
So yeah, I think we just need to be aware that if you talk to folks who haven't come to this meeting, and we can share this hopefully, Rebecca, on our websites, All the links are live on the actual PowerPoint presentation, so I can copy that in and send that to you via email. Because at the end of the day, if we get more people engaged in this during the winter months, when things are going to escalate, unfortunately, that is the prediction.
Mitigation measures work.
So
Those masks.
do you all
But
have a
yes.
feeling for kind of what the participation rate has been for Mount Tabor Middle School?
I don't know what the numbers are right now. It feels like there's quite a few opt-in forms that have been coming into the office daily, but I don't have a specific number off the top. I'm not directly touching those forms.
Okay.
I think it's also important to note too, that as we're doing asymptomatic testing, we're going to catch cases that don't actually exhibit symptoms, which is the space that we're in right now. Kids develop symptoms, they get a rapid test at school, they're tested, from their parents outside. So we may see more cases show up. And I know that people have been really nervous when they get notifications from the school that there's been a positive case. And I know like my mom heart, because I've got a daughter at Tabor as well, like gets a little fast, right? You're like, oh my gosh, my kid is exposed to like there's stuff in the, we're going to see probably more of those with our asymptomatic screening. But if we catch them early, like Kindra was saying, like we have the ability to stop them. And I know as we get into the winter months too, like where our quarantine measures are with especially indoor lunches and the spacing we have available, we will see, we will definitely see more quarantines that have to happen. Luckily, we've got seating charts and we've managed to keep those exposures pretty darn small as a school. But I think that's an important piece of the education of when we're doing the asymptomatic screenings, that we may see more reports of positive cases at school and more contact tracing happening, but that's not necessarily a bad thing.
And also like, because you know that that asymptomatic testing is happening, you can sort of feel more comfortable that if something is coming into the school, it's going to be caught really quickly. So, yeah.
And honestly, like Kindra was saying, unfortunately, the United States has not invested enough in testing. So when we actually have an upsurge, you can't get access to testing in an appropriate time frame. So if you're already opted in, and it feels really great right now because it's October and we haven't gotten an email in a couple of days or a couple of weeks or whatever, but then, this will allow you to also track your family's care through all the different schools. So I just think that information is power, and I don't think we should bury our heads in the sand, regardless of, a few days out is not going to hurt anybody. But I think I just encourage us to do it, and that's it. And
Yep. Thank you guys for being so welcoming and letting us speak. And Rebecca, I think that's it. So unless anybody has any other questions.
Well, there was one question in the chat from Brian Fajardo, and this is probably more for Tanya. And it says, I uploaded our child's vaccine card to Parent View about a week ago. Is this readily available to the Mount Tabor Middle School staff?
I know it's readily available to our office staff. I need to talk with them about where I can find those, because I know I'm asking families when we do have a positive case and their student is identified as a close contact. I've asked them directly to email me or send me a picture of their student's vaccine card so we can verify that with county health as well. But it should be, if it's been uploaded to Parent View, technically there's a way for me to see it. I'm just not sure where it is yet.
And then one kind of other item is just simply, I understand that quarantine means you're not physically at school, but we still have Canvas up and some virtual options available for students. So quarantine doesn't necessarily mean no school. Correct. Do I have that right? I haven't had to take advantage of it yet personally, but I'm ready. Okay.
It's not a 10-day vacation.
That's right. Bummer. Well, Sabina.
Does that mean that the school and like the teachers have decided on or agreed upon like what the protocol is there are a bunch of quarantine children so that there's actually like education happening as opposed to just kind of this catch up? Does that make
So
sense?
I can tell you that for our Mount Tabor staff, like teachers, like across the district have some guarantees in regards to what options they choose to engage in. Like there is not a requirement across the district for teachers to offer like virtual classes that are live streamed like we saw in CDL. But I know my expectation for my staff is that they're posting weekly learning targets in Canvas and they are uploading assignments there so that if students are in quarantine, that they have access to those assignments that they can be completing from home. There's even attendance codes if students are quarantined at home and they're completing assignments and submitting them via Canvas, that we mark them not absent, but WC, which is work completed, so that we know that they've engaged with schooling on that particular day. So it doesn't count against their attendance.
Thank you. That's very reassuring.
Yeah. Thank you, Sabina and Kindra. I really appreciate you guys being here. And thank you to everyone who's here at the meeting this evening. Before I close it out, I want to check with my other board members. Is there anything